Do you ever wonder if your vaginal discharge is normal or find yourself wondering why things feel drier down there some days and not others? You are definitely not alone. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. And today, we're talking all about vaginal lubrication and secretions, what's normal, what's not, and what you can do about it. Let's start with the basics. There is a huge range of what's considered normal when it comes to vaginal discharge and natural lubrication. For example, some people might notice moisture in their underwear every day, while others rarely see anything at all. Both ends of that spectrum can be completely healthy. That said, many of us experience times when things feel drier than usual or much wetter. This can happen naturally due to hormone fluctuations, especially around ovulation or during different phases of your period. It's also common for vaginal lubrication to shift with age, pregnancy, stress levels, or even certain medications like antihistamines or birth control. Let me share a quick story. One user who came to us through the UB symptom checker mentioned feeling unusually dry during intercourse and was worried something was wrong. As it turns out, she was in the middle of a high-stress work cycle, wasn't getting much sleep, and had recently changed medications. After reviewing her symptoms and talking to a doctor, she found that using a water-based lubricant plus a few minutes of extended foreplay made all the difference, no prescriptions needed. So, if you're feeling dry only during intimacy, you might just need more arousal time or a lubricant. But if dryness impacts your daily comfort, like itching, burning, or irritation while walking or sitting, then it's time to check in with a healthcare provider. Persistent dryness can sometimes point to conditions like atrophic vaginitis, especially for people in menopause, and there are highly effective treatments for that. On the flip side, let's talk about heavier discharge. If you ever feel like you need to wear a panty liner or change your underwear several times per day, that alone doesn't mean something's wrong. In fact, many women naturally have enough healthy discharge to soak through lightweight underwear. However, it's the type of discharge that can raise red flags. If your discharge is greenish, smells strongly fishy, or looks like thick white cottage cheese with itching, it might be time to get checked for an infection like bacterial vaginosis or a yeast imbalance. Now, here's a super common question. Should I wear a pad every day for discharge? I get it, discharge can feel uncomfortable, and disposable pads might seem like an easy solution. But here's the thing, most store-bought pads are made with synthetic fibers, bleach, and chemicals that can irritate delicate skin and throw off your pH balance. Daily use of those products? Not ideal. Instead, try switching to breathable 100% cotton underwear and changing them more frequently if needed. There are also period panties and reusable liners made of cotton or bamboo that can be gentler on your skin and more eco-friendly. These small swaps often lead to reduced irritation and a healthier vulva overall. One tip I always give, avoid using tampons outside of your period. They're super absorbent by design, and using them daily can dry out your vaginal tissues and increase your risk of irritation or infection. So, what does all this mean for you? If your natural lubrication seems to shift throughout the month, that's probably completely normal. If you're uncomfortable, transitioning to using lubricants during intimacy or switching up your underwear routine can bring quick relief. And if things ever start to feel unusual, whether too wet, too dry, or just different from your norm, a quick check-in with a healthcare provider can give peace of mind. Worried about your own health? Start by checking in with the UB symptom checker at ubhealth.com. It's medical grade. Doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And don't forget to like and follow for more doctor-approved info you can trust from UB Health. I'm Dr. Mickey. See you next time.